What are you doing, Tiffany? You haven't seen this new video? It's called The Seizure Come with Death. You should do the dance with me.
I think you're doing pretty good yourself. I'll just chill.
Come on, Caitlin! Check this out.
It's a pretty good video.
I know, check this out.
Is this part of the dance, Tiffany, or... Tiffany. Oh, my friend is shaking. I don't know what's going on. She's just watching Seizure Come with Death. Should I hold her down? No? Okay. Turn her on her side. Okay, I got it. Should I stick something in her mouth?
Seizure come with death. Seizure come with death. Do the seizure come with death. Come in.
Hi Tiffany, my name is Cheryl. I'm your nurse today. I'm also the nurse educator here at the hospital about seizures. How are you?
I'm doing fine.
Good. Do you know why you're here today?
I don't really remember. All I remember is I was at home and I was watching a YouTube video and I started dancing and then I just passed out.
Where's Tiffany?
The next thing I remember is waking up in the
Tiffany!
hospital.
Oh my goodness! Oh, I came as soon as I could.
Mom.
Oh my goodness! Caitlin called me. Are you okay? What happened?
I'm okay, Mom. Calm down. Nothing happened. I was just at home and I was watching a YouTube video and I just passed out.
Okay, so you were drinking again, huh?
Mom, no.
I'm sure, because you were hanging out with that bad crowd again. I told you not to hang out with them.
Mom, it's not
Oh,
my friends.
you wait until your dad has built this one.
Hi Mrs. McGuire, I'm Cheryl. I'm
Hi.
the nurse. I'm also the nurse educator here at the hospital about seizures. How are you today?
Worried.
Okay, well I was just about to go over what happened today and the condition that your daughter has. So if you have any questions, just stop me in between, okay? Alright, so it looks like that you have a previous history of seizures, that you've been here before within the last 2 months with seizures. Do you remember that?
I don't quite remember, but slightly.
Okay, did they explain to you exactly what a seizure is?
They did, but I really didn't understand.
Okay, and we'll be going over all of that, okay? Alright, we did do some diagnostic testing. And along with that and your past history of seizures, Dr. Edwards did inform you that you do have epilepsy.
Epi who? I'm gonna die.
You're not gonna die. You're not gonna die. But you do have a serious condition. With epilepsy, what occurs is, there's a misfiring in the brain. So let's say, for example, that you're going to call your friend and tell her that you're going to meet her someplace at 3 o'clock. Okay, so you call her, you're waiting, and you get disconnected. Your friend never receives the message. That's kind of what happens in the brain. Your brain isn't receiving the message that it's supposed to, and you seize out.
Seize out.
Did you learn that from the video?
I did.
She gets all her dance moves from me.
I'm sure she does.
So what causes this to happen?
Well, there are some risk factors associated, but this is with seizures alone. With epilepsy, nothing really triggers it. It just occurs. That misfiring just happens. So some of these risk factors can make it a little bit more, just kind of trigger it a bit more. But normally with epilepsy, it just happens.
Okay, so I have this seizure disorder. What does that mean? So what does that mean for me?
Well, there are a few complications that can occur with this if you don't manage them well, because they can be very well controlled with medications. But if you don't take your medications as prescribed, you can end up having recurrent seizures, and you can have them sometimes back to back, which is called status epilepticus, which that can result in death, which is why, it's important to manage.
It's official. Seizure come with death. I'm gonna die.
You're not gonna die. You're not gonna die. Let's go over how we're gonna manage this. It looks like that Dr. Edwards is going to prescribe you an anti-seizure medication. We're not quite sure yet which one. He wants to look at the diagnostic test again and figure out the kinks and find out which one's going to be best for you. Now with these medications, it is important that you take it every day at the same time, so say at 9 o'clock. If you miss a dose, don't double up on it the next day. So say if it's 5 o'clock at night and you're like, oh no, I forgot to take my seizure medication, take it then.
Okay.
Don't go taking it the next day at 9 o'clock again, because that can be more detrimental to your health than beneficial.
So don't take 2 pills at the same time or something?
Correct.
Okay.
Correct. You don't want to do that. Let's see. It looks like you're on orthotricycline birth control. Is that correct?
That's correct.
Okay. Are you taking that every day like you're supposed to?
I am. I miss a dose from time to time, but for the most part, I remember.
Okay. It is very important that you remember to take that. So I would highly suggest taking it at the same time that you take your anti-seizure medication. And a great way to remember to take both of those is, on those iPhones, smartphones, they have calendars and clocks and stuff. Put it in your calendar, have it go off at 9, and you'll remember to take your medications. Patients have said that worked great. I actually did it for my grandma with her pills, and works like a charm. She remembers them all the time now, so. All right, and then, let's see. It said that you didn't have any alcohol in your system when you came in. It is important with these medications to refrain from excessive alcohol
Oh my
consumption.
God! So I can't drink?
I didn't say that, but you want to limit your consumption, because with these medications, when you drink with them, it can cause nausea and vomiting and upset stomach. But with that said, you shouldn't skip your pill just to go out drinking.
Okay.
Okay? Because you could end up having a seizure then. Let's see, what else? Oh, that's right. I wanted to show you the seizure frequency chart. I will provide you with copies of this. What you do is every time that you have a seizure, Mrs. McGuire, this is important for you and also for your friends, so carry these on you. Just write down the day that it happened, what time it started, what time it ended, what you were doing beforehand, so that we can better titrate your medication for you. Okay? All right.
So what do I do if she does have a seizure?
If she does have a seizure, that's a great question. I actually have some stuff on this board here. When she starts having a seizure, just let her have it. Don't try to stop it. Older guidelines used to say, hold their head in place. Don't. It actually can cause further injury than helping. So it's also important to try to turn her on her side so that she doesn't end up choking on her vomit, because you can end up vomiting from it. It's also important, don't put anything in her mouth, because she can end up biting down, because they don't have control over those muscles at the time. So you don't want her to choke on anything that she could possibly have in her mouth. It's also important to remove nearby objects. So say if she's by a table or a chair, move those things out of the way to prevent further injury from occurring. If she has tight clothing on, like say, you're out with your friends, you don't look like you're really wearing tight clothing, but if you do, have them loosen that tight clothing, because it can cause further damage as well. If your seizure lasts for longer than 5 minutes, which you're going to note on your frequency chart, you need to call 911 right away, because that could be the complication of status epilepticus occurring, and that, like I said, you can die from. We want to prevent that.
Okay. So no alcohol. Can I drive?
You're not allowed to drive for 3 months. You have to be seizure-free. You have to be seizure-free for 3 months. So that's why it's important to bring in these seizure frequency charts to your follow-up appointments with Dr. Edwards. Because once you're seizure-free for 3 months, he'll allow you to be able to drive again. We just don't want you to cause injury to yourself or to others, because you could possibly have a seizure within that time.
It's okay, honey. I'll just move in. I'll see if you're having a seizure. I can take care of you. I'll take you.
Mom, you're not gonna take care of me.
It's okay. I'll
You're
just
not
move
coming
in
to
with
the
you.
doors. No, Mom. Ugh.
We do have lots of resources, okay? There are a lot of people that you can reach out to. I do have some resources that I will provide you with, such as Epilepsy Foundation, EpilepsyResource.net, and the American Epilepsy Outreach Foundations. They also provide support groups, because sometimes some people are impacted by their condition that they have. It really doesn't affect people that much, as you can see by some of the research on here, but it can happen.
Okay.
Okay. Well, do we have any other questions?
No other questions, but
I don't think so.
on
Thank you so much.
You're welcome. Thank you. It was so nice to meet you both.
On another note, Chapin, A+.
A+.
Okay.